The fallopian tubes are two thin tubes, one on each side of the uterus, which help lead the matured egg from the ovaries to the uterus. A blocked fallopian tube, which is also known as tubal factor infertility, is when an obstruction such as scarring, an adhesion, or infection prevents the egg from traveling down the tube. This can occur on one or both sides, and it is the cause of infertility in up to 30% of infertile people with ovaries. It is unusual for people with blocked fallopian tube to experience any symptoms. Many with this condition assume that if they are having regular period, that their fertility is fine. This isn't always true. Each month when ovulation occurs, an egg is released from one of the ovaries. The egg travels from the ovary through the tube and into the uterus. The sperm also needs to swim from the cervix through the uterus and through the fallopian tube to get to the egg. Fertilization usually takes place while the egg is traveling through the tube. If one or both fallopian tubes are blocked, the egg cannot reach the uterus and the sperm cannot reach the egg, preventing fertilization and pregnancy. It is also possible for the tube not to be blocked totally, but only partially. This can increase the risk of a tubal pregnancy or ectopic pregnancy. The first symptom of blocked fallopian tube is often infertility. If you don't get pregnant after 1 year of trying or after 6 months, if you are age 35 or older, your doctor will order a specialized X-ray to check your fallopian tube along with other basic fertility testing. A specific kind of blocked fallopian tube called hydrocephalus may cause lower abdominal pain and unusual vaginal discharge, but not every woman will have these symptoms. Hydrocephalus is when a blockage causes the tube to dilate and fill with fluid. The fluid blocks the eggs and sperm, preventing fertilization and pregnancy. The most common cause of fallopian tube is PID, pelvic inflammatory disease. It is the result of a sexually transmitted disease, although not all pelvic infections are related to STDs. Also, even if PID is no longer present, a history of PID or pelvic infection increases the risk of blocked tubes. If you have one open and the other and are otherwise healthy, you might be able to get pregnant without too much help. Your healthcare provider may give you fertility drugs to increase the chance of ovulation on the other side with open tube. It is important to note that these medications is prescribed to help you conceive, but it will not unblock or block fallopian tube.